OptumCare Cancer Care, the sponsors of this segment, is here to help you and your loved ones prevent cancer. Rocky spoke to them to learn more.
Welcome back, Dr. Gollard. It's been a while.
Oh, thank you so much, Rocky. It's great to be here.
Great. So we're talking cancer prevention. That is obviously an extremely important topic. Let's just start with the basics of understanding cancer and the struggles that you guys are facing.
Absolutely. Well, the problem is really that cancer is not just one disease, it's many diseases. It's characterized by an abnormal growth of cells. It can start in the lungs, the breast, the colon, even the blood or bone marrow. And the cancer cells can spread in a variety of ways. And as there are very many types of cancer, there are very many ways in which cancer can present. Oftentimes it's quite insidious. It doesn't run up a flag and say, hey, I'm here. People will have other constitutional symptoms, and sometimes the cancer will present at an advanced state, and that makes it much more difficult to treat.
Of course, and to prevent that from happening, cancer screenings are extremely important. So let's talk about what you guys offer in terms of screenings.
For instance, mammograms are recommended at certain prescribed times for the prevention and early detection of breast cancer. Pap smears and the HPV test are recommended when looking for cervical cancer. Colorectal cancer almost always comes from precancerous polyps. So we recommend periodic colonoscopies that can range from anywhere from 5 years down to 1 year, and some people who have extremely high-risk conditions to every 10 years to people who are low risk. And finally, lung cancer. We even do recommend scans for some people who are at high risk for developing lung cancer. So it's really important to individualize risk and be able to talk with your primary care provider about what sort of cancer prevention fits you.
Right. And what about things people can do at home to help prevent or the risk of cancer?
So lung cancer, try to eliminate smoking and even secondhand smoke. Skin cancer, don't spend a lot of time in the sun or cover yourself up really well, or use really good sorts of barrier creams so you won't get all those potentially harmful rays. Limiting alcohol so that you aren't at so much risk for cancers of the voice box or the mouth. And those cancers are very much linked to environmental toxins and exposures. So it's really, really key to do what you can in terms of the way you live your life to, shall we say, mitigate risk.
Thank you to OptumCare Cancer Care for sponsoring this segment. They have locations across Southern Nevada. Just call 702-724-8787 or visit optum-cancer.com.